a lot of the suggestions in our area, and this I'm sure goes for suggestions in all of the areas, require that there is adequate funding for treatment and housing. Without that, things like therapeutic courts don't help. You can divert people as much as you want from the criminal justice system, but if there is not treatment or housing to divert them to, it's just a nice paper exercise, but it doesn't accomplish your intended purpose. So those were our guiding principles. Then we thought it'd be helpful to divide them into 3 categories. Probably could have been divided into different categories, but this is how we did it. The first category is policy and legislative. So in other words, things that would require action by the legislative body, generally our city council. First one, an alcohol impact area. We've talked about that a little bit in the past, but that's a mechanism under state law that allows a municipality to designate an area within the city, or areas, it can't be the entire city, that are particularly affected by alcohol sales, and within those areas to ban a list of products that the jurisdiction comes up with, and those typically are high potency, low cost, single serving takeaway products. The fortified beers in big cans, the MD 2020, that kind of thing. And that's been shown in several cities to be somewhat successful. The the Washington State University actually has a research entity that tracks these things, and they've found, for example, in Tacoma that there was a 36% reduction in alcohol-related responses by police and EMS within the alcohol impact area. There was a 10% increase in other areas, which you would expect to be some moving the problem, but the net was 26% decrease, which is great. The next item is to amend our aggressive panhandling ordinance to prohibit panhandling at intersections and on median strips. So this was intended to, not. We didn't think it was appropriate to try at this point anyway to ban panhandling citywide, but we did have enough folks on the subcommittee that thought we should at least get rid of the guys with the signs on the intersections that create a safety hazard for some or distraction, and make the gateways to the city look a little less attractive than they should. And that is an approach that has been taken in a number of cities around the state. So there's precedent for doing that. Third, more detox beds, including a secure detox facility, which Sheriff Trineri talked about, something that they need right now. They're in a bind when they pick up certain folks that are too intoxicated to go into the jail, so they end up at the emergency room, which is a very expensive way of letting people sober up. So we included that. And then the next one is what we were just talking about with the Carnegie building. The group felt strongly that we should do what we can to support the county's proposal. It goes, did I skip one? Oh, I'm sorry. Yeah, I forgot my glasses today, so I'm kind of looking at the shape of paragraphs and trying to remember what we did here.
You're faking it, huh?
I'm faking. Well, that's nothing new, but more so than usual, I think. Identify, clean up, and monitor encampments, but in a way that gets people into services, including housing. So that's what the fellow from Tacoma, what was it? Not Troy, but the other one, Colin. Thank you, Colin DeForest, talked about their program in Tacoma. It's not the same thing as cleaning up encampments just to get rid of them. It is the combination of trying to clear out encampments, which can be a very unhealthy environment, and get those folks into services that will help keep them from living in those kinds of encampments in the future. Then the jail transition services, that's the Carnegie building. That goes just right to the heart of a lot of the things we're talking about in this task force. It catches folks who are coming out of the jail or possibly heading into the jail, and tries to break that cycle of homelessness, arrest, jail, back to the streets again by hooking people up with services and temporary housing. It just looks like a real effective way to keep from dumping people back on the street, which is part of what we're all about here. The next category, alternatives to incarceration. The first two are a little bit different in kind than the third one. The first two, day reporting and work crew, are at least in part, remember we talked about the rapidly rising expense of the traditional arrest, prosecute, jail model. These address especially that jail component of that cost. To the extent that we can replace jail, and again, this is just for appropriate individuals. We're not saying no one's going to go to jail, but to the extent we can get the same result without incarcerating folks and having them suffer the unintended negative consequences of jail and not have the city paying the hefty price of jail by doing day reporting and work crews, that frees up money to do things that are more productive, which brings us to our third item, expand the use of therapeutic courts. Our criminal justice panel talked about our community justice alternatives program, which is essentially a mental health court. This suggestion would be both to expand the capacity of that court, because we have more folks who would benefit from that than we're able to handle right now, and to expand the breadth of the court to include, for example, the drug court and possibly a homeless court. So make greater use of problem-solving courts that are consistent with our first guiding principle of getting at the underlying problems for these people and diverting them into more useful services. The next category is systems. Thank you. Develop a multi-agency team to respond to frequent utilizers. This is one of those things that Mark was referring to earlier, something that is in part underway. It's a very preliminary stage. We've had a couple of planning meetings, but the idea here is for police, the jail, the hospital, EMS, and probably others to identify those individuals who are responsible for a disproportionate share of public resources being spent. So, yeah, I mean, we have, I'm sure Bob Downey can tell you about what EMS faces and others here. There are folks who've been arrested 20 times in a year. There are folks who go to the emergency room dozens of times a year and cost hundreds of thousands of dollars. And of course, when they're not in the emergency room, they're often in jail, costing more money. And the idea here is to identify those frequent utilizers, those high utilizers of these public resources, and for each one of them, develop a more tailored approach. And that will look different for each person, and it presumably will be heavy on services, but to try to, and the goal here, of course, would be nice to fix people. But it's, even if we can't fix people, we can at least improve their quality of life significantly and significantly lower the amount of public resources spent on them. If we can spend $100,000 a year on somebody who's now causing us to spend $300,000 a year, that frees up a couple $100,000 to use for other things that we're trying to get at here. Implement evidence-based best practices in probation services. That's pretty, I think, explanatory. We run a probation department in connection with our municipal court. We know a lot more now about what works in probation than we did when the court started 25 years ago. And this is just a recommendation that we take a real hard look at what we do in probation, who we put on probation, and what type of services are offered, how frequently they meet with probation officers. There's a lot of research out there showing that you can reduce recidivism by putting individuals who are at the highest risk of reoffense on probation and offering certain kinds of service and imposing certain kinds of requirements And conversely, oddly enough, for low-risk reoffenders, putting them on probation can, and no one's quite sure why this happens, there are different theories, but putting them on probation can increase the risk of reoffense. So it's a way of targeting our probation resources in a way that benefits the community more by reducing recidivism and thereby reducing street crime of the sort we're talking about here. Incorporate outreach into police and EMS. This draws from the Santa Monica model, which Bruce Bosman was prepared to talk to us about last time, and we did not have time to get to him, but his materials are in your materials. That is the model that we've referred to a few times. Our police, a couple of our folks went down to Santa Monica and learned from them about what they're doing, because they do have a very successful program. And one of the things that that is at the center of their approach is this incorporating outreach into police, whether that means embedding a social worker in the police and in EMS, or providing these EMS and police with a lot more information on referral possibilities, probably both of those things and other things, but just broaden our view of what police and EMS do with regard to the street population. Increase law enforcement presence in commercial core areas. We've heard what the constraint on that is from Chief Templeman, and that is why, and I don't know how feasible this is, Chief, you may want to comment on this, but several folks had the idea that until we get enough officers on the force to be able to devote more of them to foot and bike patrol, there may be a way to use non-commissioned personnel to walk the streets and form relationships with the people living on the streets, form relationships with the business owners, just be aware of problems, what's happening, and be aware of services, referral possibilities, and that kind of thing. Return released individuals and other dislocated individuals to the place of origin, or where they may have more support than they have here. Right now, people arrested no matter where you're arrested in Snohomish County, you're booked into jail in Everett, and when you're released onto the corner of Oak and Pacific. And some of those folks have rides back to where they're going, some of them don't, and some of them don't have the wherewithal to make it back at all, and they become part of our street population. And you can imagine that the ones least likely to make it back to the town they were arrested in or to where they have family are the folks with the greatest needs, people with mental illness, people with addiction, people with no money. And this is just a recommendation that we figure out how to get those folks transported to a place that makes more sense. And again, I want to emphasize this is very different from saying we want to pick people up and bus them out of town. This is taking people who have found themselves in Everett for one reason or another and have someplace else that makes more sense that they would rather be, and figuring out how to get them there. The next item is related to that, and that is having our police and EMS and others just be aware that they're going to run into people on the street who are in the same situation. They may not have been released from jail last night, but they're dislocated and they're stranded here. And if they would rather be someplace else, then we want to make sure they can get to that place, both for their own well-being and so that we can focus our resources on the folks who are truly here and want to be here. The last recommendation is to implement a countywide justice reinvestment model or other ongoing collaborative systemic review. That is pretty ambitious, and it's definitely a long-term endeavor, but it is something that is being done around the country. The Bureau of Justice Assistance and the Council on State Governments has come up with a program called Justice Reinvestment. And that is a real intense effort by all the entities in the criminal justice system, countywide, city, police, sheriff, jail, municipal court, superior courts, district courts, to look at how criminal justice dollars are being spent, devise ways to spend those dollars in a more effective way, and use any savings you realize to invest back into other effective public safety mechanisms. So those were our recommendations, and I'd be glad to answer any questions. I think, am I allowed to say that?
You are. Please. Questions or comments for David and or other members of the subcommittee want to chime in here? We'll start with Ken. Thank you.
Just a couple of comments. The good news is on the first one on the second page, the identify, cleanup, and monitoring for encampments, what Pierce County or City of Tacoma talked about. Mm-hmm. We do have on a small level something going on already, working with law enforcement and working with Public Works and working with VOA and with Compass Health and the PATH program, where we have a protocol in place where folks can call into VOA and the 211 number and can report an encampment, and the PATH program from Compass will send in a team. Now, it's not very well capitalized, mm-hmm. and it's operating on a current shoestring, but it is a base, okay. if you will, that if that's something that folks around the table want to pursue as one of the top items, know that there is a beginning already with some protocols. The other one is the day reporting. One of the things we did talk about relative to the RRR program, the Rapid Recidivism Reduction, otherwise known as Carnegie Building, we did talk about that particular location at some point possibly being able to be a day reporting center as well. So we can keep that in mind. And the work crew idea, of course, I think most of you know that New York City, a number of years back, did do something like the work crew, having folks that were homeless go around helping clean up the city. So, somebody's tried it and it seemed to do well there. And then the other one, incorporate outreach into police and EMS, at least on the EMS side, and Bob could speak to this probably better than me, but there are some models in Snohomish County, at least with EMS.
Community paramedic.
The community paramedic that Verdant Health Commission has funded with Fire District 1. And then there's also the Everett Fire Department working with Molina Healthcare and their care coordinators doing a different kind of a model. Mm-hmm. So there's some models already and baseline already being implemented and some evaluation going on relative to that. So just for information for the rest of the committee.
Great.
Laura.
Sorry.
Okay, since I was on the committee, just a couple quick explanations. When we refer to recidivism, we're talking about somebody who's already committed a crime, and so they're in the criminal justice system, and then recidivism is how likely they are to go commit crimes again after we've punished them with the criminal justice system, as our city. And then panhandling, the reason why we wanted to specifically amend it as to medians and intersections is because there's an increased safety risk to pedestrians and also vehicles stopping there. And then the alcohol impact area, we talked about this a little bit during one of the general meetings, but that those areas will have to be reasonably related to why you want to pick that area, such as maybe doing it around schools or other higher risk areas.
I like the guiding principle changes should be viewed and implemented as a part of a system-wide approach, but I'm interested to know what the system-wide means. This is internally to the criminal justice system, I assume?
Well, that's a very good question. It is, I think, there are two levels there. One is that within the criminal justice system, we should look at recommendations and how they affect the entire system, and that is something that we thought about in coming up with these recommendations, but in the longer term would be analyzed as part of this justice reinvestment model, the county-wide look. But I understand you're getting at the second level there, which is how do things that happen in the criminal justice system fit into a model that includes the service agencies and the system with a capital S. I don't think that is, well, Flora, you can speak this. What did we mean when we said system-wide approach? I meant system-wide within the criminal justice system, but if you wanted to make a recommendation, as one of our recommendations to include on the ballot, that there be some ongoing analysis after this group is finished looking at that, I think that'd be a productive recommendation.
I think a system is one in which you have capacity in each of the areas of competency required to empower all elements in delivering good results. And I think the criminal justice system needs to interface with broader systems in the community, and we need to, my thinking on systems development is you find the best partners or the best leads for each of the elements in the system and invest in building their capacity to deliver results. I think we have way too much peanut butter funding, which spreads the money all around to all the good things that could be done, rather than investing in providing technical assistance and capacity building as we build a system to have impacts.
I want a friendly amendment to expand the reference to system-wide in here to include a broader sense of system beyond just CJ.
Sure.
I like the peanut butter. That's pretty good. Spread.
That's good, Ed.
Chocolate with it helps too.
Sure.
Yeah, okay. And are people okay? Do you want to, anybody not want to vote on these guiding principles in addition to the projects? And we'll just have we'll have the system-wide approach be an expanded system, not just within the silo of criminal justice, if you consider that a silo. Megan.
I have a quick clarifying question. For under day reporting, for reporting to a non-secure facility in lieu of secure confinement, would that include schools for underage offenders or school-age offenders?
Could you rephrase that?
For day reporting, do you want to answer it?
Yeah, just the city doesn't have jurisdiction over juvenile criminal justice. That's actually a county thing.
Oh, okay.
So in that we were looking at what the city could do with its municipal laws and its prosecutor, we just don't have. So I mean, we could probably recommend to the county who does handle juvenile prosecution that this is a good idea, but as far as what Everett can do with its city council, we don't prosecute juvenile cases. So.
And there are pretty good diversion programs out of Denny Juvenile Justice, so I think we've, in juvenile justice, there's been pretty solid work, and we've made headway on this already, so we may be ahead of the curve in comparison to the adult justice system.
Great, thank you. James, Bob, do you have your question anymore?
I just wanted to make a comment. David mentioned tracking frequent utilizers in EMS. So this is a small success for us, maybe. So we had a gentleman that we saw 133 times and transported to Providence. He ran up a bill at Providence about $500,000. He's been a real problem, a real burden for EMS. Through Ken Stark's office and Dr. Robin Fenn, David Hall and Hill, I forget his last name. Kamen. We were able to box this gentleman and divert him from the criminal justice system into what I call the mental health court. He is now in a treatment center. He's extended his treatment himself voluntarily, and we actually found a place for him to live when he comes back. So we're hopeful, we're going to eat this elephant one bite at a time, and he's our first. And hopefully this will be a success.
That's a good.
Thank you.
That's a good story.
It's a very good story.
Yes.
Thank you. Bob, James. Bob.
We actually have two of those that we've worked with, that I've worked with the Everett Police Department. And I talked to them. They called me, let me know they got these guys in jail, and then I can make the process, start the process of getting them into treatment at Pioneer Center North. And also, I just wanted to mention that part of this alternatives is, that's what we're working on. I'm going to speak with their chart program for the high utilizers next week and let them know how the process works so that we can work with, I think they said it got 11 more on their list that they're working with. So, and yes, and I do try to house some of them in our sober house when they do come out of treatment. I put 3 guys in that were homeless this week, so. But it's getting the other needs met as well. Getting their medical needs met and their chemical dependency needs met at the same time. That helps them to get on their feet, and we have somebody in the house that we have monitoring and encouraging them along the way. So it's a big process, but it takes more than just housing. It takes that case management. It takes that somebody working with them on a regular basis to help them learn how to go through with these other processes for life.
And what this recommendation would do would be to institutionalize what you guys have learned in these couple of ad hoc cases, and to try to streamline the relationships with service providers so that someone's identified and that triggers a well thought through system and gets them efficiently hooked up with what it is they need. But yeah, I know you guys have had a couple of real successes just kind of pioneering this.
Bob?
A comment on the ordinance with respect to panhandling. That proposed change, in my mind, that proposed change not only affects the perception of visitors who drive into Everett as to what type of community it is, it also, from the perspective of a homelessness prevention provider, human services provider, it will help change the community's perception of what homelessness is. And many people, that's all they see, and they really don't understand it. So I think it's important to all of us.
Good comments and questions. James, you have one more?
Yeah, I did want to make one more comment. We also have last year we made a partnership with Providence, and they're high utilizer people that they are calling us on a regular basis. We've done 6 assessments at Providence in the last month, and we've got some of those people, well, a couple of those people are actually at Pioneer Center North now, and other treatment centers. So we continue to improve that partnership, and I mean, but the numbers are increasing.
Okay.
I'd just like to make one more last comment about that. I mean, just from listening, you can see that it's only going to work if we partner with each other. None of us can do it alone. And it just emphasizes what's in the document about the necessity for us to look, even Ed, about what you said, system-wide partnerships, looking at the data, and having a success one person at a time.
That's a good point. And the expanded systems definition, be clear that that's what we're talking about there. Thank you, David, and everybody. And thanks again to the committee members. And I think that was really that was a great report. Yeah, so we're going to move on to the second report, and Cassie is going to be our speaker for this subcommittee, right? Outreach and Emergency Services.
Great, thank you. So I'm not going to read all the names, but we had a great committee of folks looking at outreach and emergency services. We had 2 meetings. We kind of scrambled to get the proposal together, so we weren't able to send it out very far in advance. So I'm going to kind of read through it and certainly welcome questions and comments from my counterparts on the committee. Throw in thoughts as well. The first recommendation goes to Ken's point and Ed's: increase resource training and coordinate training between systems. So, as we all know, the first responders, such as the Everett Police Department and Emergency Services, are the first line of support for chronically homeless. Volunteers from the faith-based community are also working with street-based population. And our committee, so right here when we get to the recommendation, so the recommendation is that we invest in coordinate training for all those first responders, Everett Police Department, Emergency Services, faith-based volunteers, as well as homeless service providers on things like mental health first aid, volunteer safety, outreach best practices, and available community resources. So they all have the tools to help the individuals that they are coming across, and empower the faith-based community and others to better support the street populations and improve referrals into services. So We think this is a short-term, low-cost recommendation, but needed ongoing, because there's always new people that are coming into these systems that need that training and coordination. But I think that was clear in the first one, too, so I think that goes hand in hand. The next recommendation is around drop-in day centers. So as we've discussed here, there's limited places for at-risk, homeless, mentally ill, vulnerable individuals to go. There's not enough beds. So there's nowhere for them to go during the day. We know there's nowhere for them to go during the night, too, but that's not causing, we're really focusing on the street-level social issues in this group. And in the evening, there's not the same disturbances, but during the day, there are. So we have one drop-in center for youth and young adults on Broadway that's run by Cocoon House. It's open 7 days a week, 2 to 7. And it includes laundry, showers, food served indoors, clothing, computer, work source. We talked about the importance of these day centers also kind of connecting to services, drug and alcohol counseling, case management, and recreation. So our committee recommends replicating such a center for the adult population so that the center would be open, and the center would be open 6 to 8 p.m. We talked specifically, we put those time frames in there because that's about the time that they start getting calls, right? Around 6 o'clock in the morning, people are going to work, businesses are trying to open, and so the importance of day centers being open during this time and up until 8 p.m. And then expanding the current day center hours at the youth drop-in. A third of the population that we're seeing on the streets is between the ages of 18 and 24. So we need to have the current youth center, that's a day center, we're only open 2 to 7, so it would need to be expanded as well. So this reduces the number of homeless individuals that are accessing the public places like the library and causing problems because they're trying to get in someplace warm and safe. And to ensure the good provider, business partnership, all that good stuff. So that's around the day centers. And I think I saw this in the next committee's work as well, so I think that's going to be one that comes up again. If there's questions in between, you can throw them in. Otherwise, we can do them. Yeah.
So Compass Health has a day center. It's not mentioned here.
Great. And I know that the Everett Gospel Mission operates, yeah, and so we didn't have all the support we needed on this committee, and so we were really talking about specific that would be kind of open to all, so I don't know about Compass's day center, about who all has access to it, but we can certainly add to this list of, and that was part of our recommendation too, is kind of mapping out where the services are. So Compass Health is one that should be included.
It serves 130 people a day.
Yeah, and
it's not, I don't think it's narrowly defined, so it
It's
doesn't
not-
limit it to mental health or seriously mentally ill people.
Okay, so Compass Health has a day center, and so perhaps what we can do before this goes in is follow up with Compass Health, get the exact information. Tom's not here today on the hours of operation and include it in this as well, because we want that same kind of, yeah.
I went on the tour, so.
Oh, good.
To the best of my recollection, it's primary lunch and a daycare center, but it closes at 3, if I recall, so.
Okay,
So it's obviously not open.
and I know they're not open early because we see.
Right.
Okay, so,
So maybe it's talking, just focusing on expanding the hours of existing facilities as a first place to go, and then checking in to see if that addresses the issues and figure out if they're really, at that point, if there's a need for another capacity increment. Because also Recovery Cafe, hopefully,
Yeah.
opening up in the fall, that's another increment of capacity. Yes, no?
yeah, that would be, that. And so one of the things we talked about really was the necessity, and I know that like Recovery Cafe can't hit the ground with that type of programming, but that if day centers don't include service-rich programming, it's that individuals can't get the support they need. We get kids coming into our day center all the time that need a shower, they need laundry, they need food, and so just having a cup of coffee or you know, so you need more. And so I think that Recovery Cafe is excellent, but we're recommending that day centers have more services and, you know, kind of access to employment opportunities, ways, case management opportunities to get folks into services.
Other questions on that? Mark?
So do you know if there's any other facilities like your one on Broadway in the rest of the county?
There are drop-in centers in other parts of the county. They have everything from like after-school program to church opens their basement to, there's nothing like what we operate for youth and young adults anywhere else in the county. I don't know if there's another adult day center anywhere else in the county. But there's very few day centers that have full resources. They're, you know, it's like opening a shelter, but without a
Right,
shelter.
but I think obviously a lot of the solutions that we're looking for here locally are going to also include expanding what we do here locally to South County, East County, and North County, so all of those individuals aren't coming here because that's where the services are at.
Sure. No, if money grew on trees.
No,
I mean, seriously, I think it would be excellent to have day center for youth and a day center for adults and a day center for kind of more special populations, maybe mentally health, and you know, addicted populations that might need more intensive services in every kind of major corner of the county. That's.
But part of, I think, our job now needs to be, after all the meetings that I've attended, is to convince those other corners of the county that they need to do the same thing for their community.
Yeah, yeah.
One of the advocacy recommendations is to, I believe, encourage other cities to step up on some of these same issues so that Everett is not put on and being the only place where these things are available. The point is well taken, and it's good.
Yeah.
It's a good reminder, Mark.
Yeah, yeah. Okay, so around outreach, there's very limited street outreach in Everett. So, of course, we do the youth and young adult street outreach, and we have 24/7 response. We know about the PATH program when folks call 211, and they can go out to encampments and do work. But what we heard in the presentations from providers a few weeks ago, that there really wasn't a lot of proactive outreach, that there's just not the capacity there. So we had 2 recommendations again, funding for youth and young adult outreach and establishing funding for adult outreach. Those 2 recommendations kind of ensure that proactive outreach, getting out on the streets so that it's not Everett Police Department trying to help this individual that's homeless, but it's a provider who is trying to help this individual that's homeless. And sometimes there's the idea that, well, there's no housing, so there's no reason to do outreach. But outreach is the best way to stay connected to these populations. And I think it's a lot of what Ed was also saying in the hospitality. So getting to know these individuals, building the relationship, so then when they're ready for help and ready for change, that they have a place to go and they have a partner in that work. So the importance of outreach, it's really something that is not prioritized in public funding, and it is essential to what we do. I don't know if you've seen media releases that recently went out, but Cocoon House recently lost $230,000 to do this work. So it's going to be really hard to continue the level of outreach that we've been doing thus far. 24/7 on-call outreach.
You had a question from Ed, I'm sorry.
Yeah.
You're still on outreach?
I'm still on outreach.
I'll let you finish it first now.
Okay, yeah. So the third recommendation is to consider 24/7 on-call outreach. So one is proactive. The difference of proactive is like, no one's calling us to say there's a problem, but we know that there's areas, the library, for example, under the bridge by the Mission, that homeless populations are congregating. Let's go there and start to work with folks and try to get them connected to service. The 24/7 on-call outreach is a business provider. Let's say, Renee, you're at your store, you see somebody, there's somebody you can call besides the police department, a provider that you can call to say, hey, I think this person needs help. Here's, could you come out here and meet with this person? Again, we do this at Cocoon House with dwindling resources that it may not be able to continue, but it is a best practice so that we can kind of get out there and respond, and it's not something that's currently in the capacity of providers to do that. We also talked about, just like the criminal justice team, embedded social workers with emergency responders, and/or that social worker may be a part of a provider system and do ride-alongs or work side by side with law enforcement. We do some of that in different communities. We haven't been doing it in Everett, but we are doing ride-alongs, for example, in Arlington with youth and young adult areas. So that it kind of gives the other first responders the tools of having providers or social workers right there to work with populations. So I think that, and so,
Compass Health has a federal grant for a program called PATH, which is specifically for mental health outreach. And they have 3 or 4 FTEs, full-time PATH workers. I had a conversation with Tom Sebastian last week about whether some of that talent and expertise could be directed towards the downtown Everett area. And he said, absolutely, we could talk about that. And he would see it within the mission of the grant that he has. So I think in your write-up, if you could reference that as a part of it, it would strengthen it, because I think it's already a funded resource. They probably a lot of demand, but he felt like the program could be used better as a result of what we're learning and what we're doing here in this committee.
okay, yeah, so we did talk about it, and I'm sorry it didn't make it in here. So we talked about the PATH program and the response that folks are due through 211, and didn't have quite all the clarity of how that works. So it would almost be like a third tier. We'd have the proactive outreach when there's no problems, that other than word of mouth, we know there's populations. Then it's through PATH, they could call and respond. I don't know, what's the response time? It's like a day or two, or do they go out there? Bob, you're part of it, right?
Yeah, it depends on the urgency of the situation. If it's an encampment that nobody feels threatened because they happen to be near a housing area, or there's not a danger to them because they're not under a bridge where workers are going in, then it can be a few days longer, or you might have a week to sort of work on that. It sounds like what we're talking about here, though, in downtown is a response needs to happen right away, and so that's probably a good deal of discussion and some determination of what PATH is capable of doing in that
But maybe
situation.
it's something that could be built into it,
yeah.
resources.
I'd just like to point out, Cassie talked about the current system being reactive, and it is. We currently have capacity, Compass has capacity, and whatnot to respond to calls. Tacoma really talked about a proactive system, as Cassie also talked about. That is something that if this group and the city and the county want to move in the proactive direction, we're going to have to look at expanding that capacity.
And the capacity for housing.
Yeah. So to reiterate, in the outreach section, it's like there's 4 different recommendations, and I apologize it's not sorted. Like I said, it took some work to pull it together on the fly, but ongoing funding for expanded youth and young adult outreach, establishing funding for adult proactive outreach, looking at response. It doesn't 24/7, or at least, that reactive outreach that we're talking about that's already exists, and maybe expanding on that. And then the embedded social worker or provider with law enforcement and first responders.
And would that relate to the Santa Monica model? Okay, good.
Yes, yes. So those could be one. They don't have to be 2 separate ones. It's the same one. Yeah.
All right, keep going.
Okay, keep going. Meal programs. We talked a lot about meal programs. There's multiple churches doing great work providing meals to downtown Everett. This committee recommends that meal programs implement best practices, and the ones that we cited were indoor waiting and serving areas, monitored restroom facilities for safety for the faith-based community and the individuals there, and proactive cleanup to minimize spillover impact. Engaging participants in the operation of meal service where possible. The mission does that, it's great. And so that's the one recommendation for around meal programs, is that best practices. The second one is coordinating between meal program times and locations so that we consider the best way to serve folks throughout the community, eliminating overlaps. If I think I looked at, we have a list of meal programs in Everett up in our outreach center, so I pulled it down, and there were 4 meal programs in Everett on one night. You know, so around the same time, between 4 and 8 p.m. And so maybe moving one of those to a Tuesday night, or just checking to make sure that we're covering the community so that people are fed. It's very important, but that those systems are again collaborating. And again, it's what we've been talking about all along, is just looking at those systems and ensuring that good partnership. Questions or anything I missed from Niels?
Ed, your sign is up randomly. Thank you.
Okay. Okay, restrooms. Access to restrooms is important. So our first recommendations, we spent a lot of time talking about restrooms. It took us a while to get through this one. But we recommended first mapping out all current downtown restrooms that are available to the general public where street populations would be welcomed, and adding signage to indicate these locations. Because we were talking, it's like, well, there's restrooms here, there's restrooms there. I was like, I'd never know to go there. So we need a map and signage so that we know where those restrooms are. Once it's mapped, so that's the first recommendation. The second recommendation would be to explore options for expanded public restroom access to reduce negative impacts to the Everett Library, Transit Center, and core areas. So we put explore because it's a complicated issue that other municipalities have struggled with as well. And so we don't have the solution, but we know we need to find a solution. The third would be to explore these urban rest stops in particular. So I don't know if we want to combine those two or if we just want to list that as an option, but it's definitely, we discussed the necessity of public restrooms and making sure that they're available, but making sure that they're cared for and maintained. And yeah, so the first one is super cheap and easy. The second one is a longer term and more complicated.
Okay.
Restroom questions?
Questions?
Restrooms are down the hall. Funding for treatment and detox mental health. I won't even go into this. There's just something that we all talked about. None of this is going to work if we don't have more detox beds, if we don't have more places for our mentally ill populations to be housed and receive the necessary care and services. And we recommend. We talked about, you know, whether they need to be in Everett or whether they could be in other areas, and also that funding doesn't necessarily have to come from Everett. Maybe it could come from higher levels of government as well.
Great. Comments or suggestions or questions for Cassie or the committee members? Chief.
Thanks. I just wanted to make one comment on the last item that Cassie mentioned, which was the detox facilities, and just reemphasize from law enforcement perspective, this is a gap, I think, for us. I know that when I was on the street, 20 years ago working in North Everett, and we would run into situations where we had individuals, the calls that I hear going out every day today with the man down, the assist to fire, and it's somebody that doesn't necessarily belong in the hospital. We don't have a crime to arrest him for. It probably wouldn't even be appropriate to arrest him. That we have, and the community is calling us and expecting us to do something, and we have no place to take that person. And so, I know 20 years ago, detox, we were able to get in. They had the capacity at that time, and it wasn't necessarily a long-term solution, but it helped us at that time with in terms of our officers on the street. So I just want to reemphasize that from a law enforcement perspective, and I'm glad to hear that county-wide they're exploring additional capacity, because I think that will hopefully help free up some of that here in Everett, and even for our officers. You know, if the capacity was in South County and it was open, we'd take them. So I just wanted to make that comment.
Thank you. James.
Yeah, I just wanted to reemphasize that detox is, I was working in detox in 2001 when police were dropping them off. And it's, you know, it changes. Medical detox can't do that. So that's one of the things that was, I saw it in other lists that was mentioned, and that's a sobering center. And that's another option that's really helpful for this area. If, I mean, there is the Compass Health triage, I know, but just a sobering center for those people that don't need the medical or the mental health issues, just need to sober up, would save a lot of money in the hospital.
Other questions or comments? Nice job, group. It was a lot of work in a very quick time. Thank you. So now, if Mary Jane wants to come up and join us at the table, she's going to be the spokesperson for, we asked the panel that presented on housing, permanent housing, to come back to us with their recommendations.
Thank you so much. First, I want to start by saying that I want to thank the panelists, which included
Mark,
me, Nancy
can you hand over a
Cole,
microphone?
Vicki, thank you. Vicki Howell, Ashley Lomers Johnson, and Karen Matson. All of us work for organizations that are absolutely dedicated to preserving existing affordable housing stock, creating more affordable housing stock, and being able to provide the right services in the right amount at the right time to the people living in that housing. That having been said, there isn't enough. There's not going to be enough quickly, so we couldn't just talk about permanent housing. Because we couldn't talk, do we need to create more? Do we need to advocate for more housing, more services? Absolutely. Do we have models that we know will work? Absolutely. The issues are not the people who get into these programs, but all the people who don't. And so we couldn't just, looking at things from a systems perspective, just talk about what are we going to do for people who we can get into permanent housing. So I think we've looked at a variety of recommendations that are driven, interestingly, by very much the same guiding principles as David mentioned for his committee. Definitely looking at how do we create a coherent ecosystem to address problems, particularly when you don't have enough housing. Knowing that having enough housing, having a home as a safe and stable base from which to have appropriate services is far and away the best solution for everybody. So given that, what I'm struck by too in listening to the recommendations of the other committees and ours is that we know what we need to do here. So now it's about creating the resources and the wills to make that happen. A tremendous amount of consistency between the various groups. So I feel like a broken record talking about some of these, but one of the first things we had on our list is the creation of drop-in centers. People who don't have a place to go during the day that have the resources and amenities that they need will try to make do with what they can find where they are. And we have we know that we have a youth drop-in center, that it's a daytime drop-in center. We need to be able to, we put everything politely in terms of the task force might want to consider. So the task force might want to consider looking at how to support the expansion of services at that center, as well as establishing additional center capacity for the adult population. Looking at what is it that people need while they are there during the day, and I think Kathy spoke very eloquently to a lot of the basic amenities. I spent my morning in a meeting listening to 20 helping professionals talk about where do I help people get showers. So these are really basic things, but there they all are going, they shouldn't be having to spend their time on where do I help people get showers. At the very least, we ought to be able to get people food and clothing and basic amenities and showers. But also in addition to those kinds of things, meals that if the center were developed, a lot of the churches that are trying to do things in their own facilities potentially could be helping to collaborate with meals in provision of meals at those facilities. A lot of people who are homeless do have cell phones or need cell phones, and one of the best ways to get a hold of people is to have a cell phone. We spent a bunch of time this morning talking about if you can't get a cell phone, if you don't have an address, how can we get burner phones to people because they can't stay in touch with the helping professionals who are trying to help them if they can't get a hold of them and find them and if they're constantly on the move. So if you have a cell phone, you need a way to charge it. You need internet access. This is true for everybody. It's how we're all connecting with the world, and it is no less true for people who do not have a stable nighttime residence. And the ability to meet with navigators and other helping professionals on site in a secure and confidential environment while they are on site in the centers. So again, having those facilities, having a place for people to be during the day, even if you can't get them permanently housed within 30 days, which would be all of our goal, what can we do that helps provide people the support they need and some dignity so they can work toward addressing some of the issues in their lives. We also identified, well, the other thing we were looking at here is not everything would cost the city of Everett money, and I think that's been talked about here. A lot of issues where the city of Everett can benefit just from supporting others, and I think that is certainly true in this next recommendation has been talked about here, and that is the creation of additional triage and medical detox facilities, including supporting the facility that is being looked at in South County as a way of making sure that we have facilities around the county to address needs. We also, I'm trying to speak shortly because, I mean, some of this stuff we've talked about so much, I don't want to spend hours talking about it again.
It seems, and can I just say, it seems like the recommendations from our committee and the first recommendation from your committee could be combined.
Absolutely, yes.
Speaking, I mean, so then we, as a group, we kind of know, we'll have recommendations about day centers on the voting chart.
See, we have partnerships already. That's great.
Absolutely, and certainly having recommendations about having additional triage and detox. We don't need to, like,
Have that
I don't
6
think
times
that
on the ballot.
any of us have this huge investment in if the words change that there's an issue. You know, we're more like trying to describe it rather than say it has to be our way. Again, the establishment of a diversion and discharge facility at the Carnegie Building. This is something that would not cost the city money, but is something that the city could support, and that's been talked about pretty extensively, so I don't think we need to talk about it.
That's what the CJ folks call the jail transition facility.
Correct, and what Ken calls the triple R facility, so.
Tell me what those R's are.
Rapid recidivism reduction. It's got a little political element to help sell it.
Nice.
Speaking to what some of the other groups have talked about is, and that Ken has mentioned, and that is expanding the existing encampment and street outreach response efforts in this county. We have street response efforts going on that Cocoon House is doing. The funding for that is not stable. We have also, as Ken mentioned, brought together a number of law enforcement, EMT, Public Works, Health District, PATH program out of Compass, VOA, and a number of other partners to develop an encampment and street response protocol for adults. I will add, too, that that part of our work was informed by what they've been doing in Tacoma, that Troy and Colin were doing in Tacoma. We work largely as a tri-county area, and so each of us, we share a lot of information, and early on in putting our effort together, we were working with them, and Colin was sharing with us their encampment protocols and whatnot, which I think started, initially heavily, I think, on suppression from the out, and then they moved into a more reach out, supportive, and help people take a strengths-based approach to this. So I think it absolutely needs to be enhanced. PATH does a great job. They can't, with the existing funding, can't do it all. Bob, with this existing funding, can't do it all. But let's build on what we've started building and continue to take best practices there. Cassie definitely has been doing great work with youth, and there are some differences in the approach and what's important with youth and adults, and I think it's important to take that into consideration. And then we actually moved into more permanent housing solutions, and that is really looking at what are the alternatives for increasing funding for low-cost and non-traditional housing. I think a lot of folks here are familiar with the 8 counties HO5 report out of Planning and Delivery Services, which says in Snohomish County we will need 1,000 units of affordable housing every year for each of the next 20 years and while we retain and preserve all of our current affordable housing, and I believe roughly 8,000 of those units would have to be in the city of Everett. That translates into about 400 units of housing. Building the way we're building now at roughly $250,000 per unit, $10 million a year while you're preserving, add another $2 or $3 million to preserve what we've got a year. 200 million plus over the next 20 years. We got to come up with some other alternatives here. That's, while we need that housing, we need to keep building and developing that housing, we also need to look at what are some less expensive options here for meeting some of those housing needs. You've heard discussion about some of those options, single resident occupancy, share housing. They've got a Tacoma shared housing program going on that we've been taking a look at. Container housing, park model home housing. It doesn't matter so much what it is like, let's look at the models, what they are, what's going to work in this community, and start making it possible to create that kind of housing so we can start making some headway on the gap between what we have and what we need. Some of that housing can be scattered sites, some of it can be in communities for people with a lot of support needs. Communities work very well, they have services right there on site. The more you scatter it, the more challenging service delivery is. Not saying you shouldn't do it, but you just need to take that into account. The services costs go up with scatter site than if you're trying to provide services all in one location. We have both models going on. They both work. It's just a cost differential and where you're putting resources into it that. And lastly, establishing a flex fund. What we're all finding with all of our programming is a lot of times a very small investment can make a very big difference. Not for everybody, not all the time, but for those folks that a very small investment can. A down payment, a gas card, a copy of your birth certificate. Have a fund that people can buy that. The amount of time helping professionals spend trying to get people into programs to buy a $10, $20, $100 solution is not a productive use of resource. I think we need more resource, but it's places like that that we need to look at how we can use resources more productively. Having a fund that you can go to with some general guidelines about how to do it. You have someone come in need, tap the fund to help them get that service. So I think too, we were looking at this in context of that there is a system. We need to have an ecosystems kind of approach. If we're going to, you can't, what we've been seeing through a lot of our other efforts, if you just try to do one thing without looking at how it interfaces with everything else, all kinds of unusual unintended consequences start cropping up from that. And I think too that while Everett's effort is Everett's effort, it is not happening on an island or in a vacuum. And so I think we had a friendly amendment from Bob that we take a look at what's been going on within Everett that is Everett still, that there be more cross communication between that and that what's going on at the county level through the Partnership to End Homelessness. So you got what I got.
Right. Ken?
Just to add on to the Flex Fund, I've heard a number of stories from EMS staff as well as police officers who have had situations where they run into people where the programs that might help those individuals are closed. And that the individual, maybe all the individual needs at 3 o'clock in the morning when the police officer or EMS comes across them is money for a bus to go home. And I've heard stories that EMS staff and again police officers have taken money out of their own pockets to pay for that and pay for other things. So having EMS and police departments having some kind of a flex fund to cover those kinds of emergent things could be a good investment.
Ed, I see a question on its way.
I think it's important for this task force to understand that local commitment to a housing development initiative is the key to leveraging significant dollars into our community that are taxpayer dollars at the federal and state level that our citizens are paying taxes for, and we bring in a disproportionately small percentage, representative percentage of those dollars to our community for lack of clarity of vision and purpose and commitment. So that these housing recommendations that are developed here and recommended here, we know how to go get dollars outside of our community for these housing development projects. We know how to do that. It's the commitment of local commitment of public will and local financial commitment that are the tools for leveraging the dollars needed to provide these kinds of housing. So the opportunity is here as we crystallize what we think are important initiatives to put that local stamp on the priorities and identify what the priorities are, so that we can go get the right agencies to go get the dollars that really are intended to address this kind of issue from outside of our community.
That's a good point, because this is one of the most expensive things on the table, is more housing. And that is where there are piles of money out there at the state, and particularly the federal level, but it has to be hugely leveraged to access it. Local commitment. Yeah, Cassie.
I'm adding, yeah, that is what all providers do. And so the challenge is always is, you know, where do we put them and how do the services to maintain them is what the community needs to commit to. The dollars to build them, it's all not Everett dollars. Those come from the federal government and from the state. So as Ed says, we bring in hundreds of thousands of dollars into the community of resources that we're paying for with our taxes, but they're not, you know, but we're already paying for them whether we're bringing it in or not. And so I know I'm just reiterating Ed, but I just wanted to double stamp it because it's so very true. But if without the commitment for ongoing services, those programs will fail.
I guess I direct the question back to Ed and Cassie. Help me understand, you know, why that's occurred. Has it silos, lack of communication? You know, if you wouldn't mind.
Why what has occurred?
Why we haven't had that vision and commitment locally to seek those federal or state dollars?
Well, first of all, the local housing resources are limited. And so the ability to commit to multiple projects are limited. You have many levels of need, elderly, families, youth, special populations, homeless, addictions, mental health. If we prioritize and clarify what we want as a community as our priorities, we can leverage the limited local resources that exist. But if we want to have really the maximum impact, we need to find more local dollars. And then the more local dollars will be the tool that we use to leverage more dollars into our community from outside.
Thank you. Other comments? Ken, thank you.
So if I could add to that, I think the other thing that, and this is a historical issue, it's not I don't mean this as any negative or disparaging remark about any area or geography, but historically, Seattle and King County have been very organized politically in order to tap into federal and state dollars. If we could, in the city of Everett, all the other cities, and the county as a whole, bring the players together like we have in this room to put more focus on going after those state and federal dollars, I think it would definitely benefit this community.
Ed, is another comment or just?
The State Housing Finance Commission, the State Housing Trust Fund program have dedicated housing dollars, and we need a stronger advocacy program to be able to access those dollars. And in addition to the advocacy, it's local resources and site control. Those become the variables that can be leveraged.
Others? Glenn.
Let me know if I'm out of line on this for just a bit. Jimmy, can you turn over here, please? Come on. Let me introduce you to Jimmy. Jimmy is actually from the Northwest originally, but he did his working adult life in the city of New Orleans, largest public port, actually the largest shipping port in the United States. So there's plenty of work, not always easy, but plenty of work. He got separated from his family during that time. Am I representing this correctly so far? And he just mentioned that he is from the Northwest originally, and he discovered his daughter, who lives in Linwood. He hasn't seen her for 16 years. He still hasn't seen her, or she hasn't seen him, because he's got a sense of pride and he's trying to keep it away from her. Jimmy is homeless. He does have a small stipend, probably a Social Security, and he works with an EBT card. I asked him one day, because I see him every day on my property, where he lives, where he's staying. He mentioned a church that's up the street from the shopping center on Everett Mall Way. I had a vision of this church and a room, etc. It's not. It's the bushes out back is where he lives. It's where he sleeps, where he spends the night. Jimmy is not on drugs. He's not on psycho meds. He's not a criminal. In fact, he does help us a bit around the shopping center. But he still has no place to really put his bag and sleep and take a shower. In this room, for the stuff that people were discussing, are they on the right track? There you go.
Thank you, Glenn. Thank you, Jimmy. Appreciate you sharing your story with the group. I think we are, if there are other questions, we can take them. Otherwise, I would just ask maybe a round of applause for everybody that worked on the subcommittees and for David and Cassie and Mary Chief for making the presentation. So I know we have just a couple of things, I think. Oh my gosh, look at that. And I know Bob's going to have something would like to say, but so the subcommittee recommendations will be added to the ballot. We'll try to minimize the duplication, and we will probably put an asterisk or something next to every one of these when it goes on the ballot, so you'll know it's our version of a subcommittee recommendation. So you can just watch for those. We'll try to tag them in that way. And thank you again to you guys for the work. That's really helped moving this forward and focus the discussion. I think it's really helpful. Are there any questions about what's going to happen next? You're going to get a ballot. It's going to be in the form of an Excel spreadsheet. You're going to send me an email with attaching your spreadsheet, and then I will send it on to the city. If you have trouble, we'll have a contact, I hope, somewhere. If you're having trouble with the spreadsheet, somebody can help you at the city.
I just have a quick question.
Yeah.
So since we presented the information a little differently, you know, the criminal justice did the best job of kind of saying 1, 2, 3, and housing and outreach had it kind of mushed together. So I guess I'm just offering, if there's lack of clarity, if it's a separate or if it's a combined recommendation, will you reach out to the committees, or how will we clarify that?
We can reach out to the committees. We're going to, I think between Wendy and David and Deborah and myself, we will try to figure out what's the best way to stick all these on the ballot, minimize duplication, but not artificially mush stuff together if you might likely like one piece of a recommendation, but maybe not another. Is that sort of responsive?
Yeah, because, you know, like under outreach, there were like 4
Yeah,
recommendations. So
break
maybe
those
they like
out.
1, but not all 3.
Okay. Ed, and then Megan.
For the last couple hours, I've been dwelling on the question that Greg asked earlier about this report, and it hadn't occurred to me until tonight that this is a report to the community. And I understand the importance of that, because elevating public will is going to be the key to success. The other side of the equation, however, is leadership. Nothing's going to happen unless we have leadership on this issue. I thought twice about whether I could take the time to be a part of this. And it was the mayor that sent Deborah to talk to me to get me to do this. And I'm doing it because I'm doing it out of a little bit of fear. I've been on so many committees and task forces where the report has gone on a shelf and nothing has happened. And I didn't want to be a part of another process of that type. So leadership is critical for this to come together and create the kind of results that 24 of us are spending 27 hours in these meetings, plus all the prep time, to try to make an impact for our community. So I'd like to suggest that the agenda for the next 3 meetings include an hour with our mayor, where we can
Certainly make that request.
where we can have a direct conversation with him about how we take the recommendations that we come up with and implement them in a way that will in fact be likely to have a result.
If it's helpful, I know that Chris and David and Deborah are planning to meet with the mayor on this precise issue next week and start to move this discussion in that precise direction. The idea of him coming and confer and meeting with you and having a discussion, I think they can certainly put that on the table with him and make that request. Does that help? Excellent. Megan.
Okay, I hesitate to make this suggestion because it would be making more work for people. And because we're putting together a report to present to the community, but I wanted to just kind of put it out there, if there's a way to get community input within this voting process, if it could maybe do a survey and the input is aggregated to be one vote as a task force member, as a way of getting input and input from everyone else. So they haven't been involved in the 27 hours like us, but it could be an online survey and everyone could vote, and that could represent one final aggregate number of a task force person.
I think,
Like I said, more work.
I think the mechanism for public input that we agreed to at the start of this was that we would make it very, very easy for the public to submit comments, both through the website and through the comment cards here, that all the comments get printed and distributed to all the task force members, and then we decided to hold an optional public hearing for testimony. And so I think my view is that the members here they're going to vote based on their 27 hours of learning, their lifetime of experience, and their consideration of the public input. And I think to have some separate mechanism then for the public to vote is I think is counterproductive and cumbersome, and I would recommend against it. I understand your concern.
I think it's conceivable that you could do that subsequent to just as an information item, as part of the future public outreach. You could offer that out to the public. Within the confines of this process, we would need to amend our charter, which we can always do, to provide for that. I understand and sort of agree with David's comments, but I think you could certainly take that mechanism that you're speaking about, an online survey, and make that part of the ongoing outreach. The city could choose to do that as part of the rollout of this plan, part of the next steps development, how we carry this out to the community and see what they think. I think it is an intriguing idea for the follow-on rollout of the report to see if the community agrees with the recommendations that you all come up with. That would be one way of seeing what happens. Flora, did you have a comment?
Oh, I was just thinking, since our final report is going to include our recommendations, presumably with some explanation of why we're recommending those things, and then also it's going to include the minority recommendations of people who didn't agree with the group. And so maybe if we have some sort of public online survey, it should be on the final report, because then the public will have why those recommendations are there. And then also they'll have the minority recommendations that the task force as a whole didn't vote in support of. So they would still be available to the public to look at.
Follow-on step that the public could utilize if they chose, once they've seen the final report of the group.
Yeah, still have the explanations with it.
That's an interesting idea. Is that
Can I just add that, and as a follow-up to this, I get why that is necessary and that makes sense, but to me it would be important that survey really target homeless populations and not just the community at large, because it's the people in the room, and there's certainly many other service providers that are, and community members that are knowledgeable, but we are supposed to represent that group, but the homeless individuals are not here other than through our focus group. And so it's those people that really know what they need. And so those would be the individuals that I think should be surveyed rather than the general public.
You could do both.
Yeah.
It's a good point, though, that would be a special, might be deserving of special effort to try to get their reaction to the recommendations that the group has. Good point. Okay. Ed, is that another comment? Nope. Okay. All right. So, yes.
We're still taking written comments right now, right? That people can still submit
Correct.
written
Yes,
comments. So, I mean, I think it's a
absolutely.
great question from my perspective. I think getting the public input is an important part of it. And I agree with Cassie's comments in terms of we represent that group. And I think one of the things we should all do in our voting is consider the public comments that we have heard. I think the focus group is an important thing. But anybody that wants to comment on the ballot or issues that are on the ballot, I'd really encourage them to submit something in writing, because I think that allows for even a better opportunity to hear exactly what they have to say and to filter that back through the task force in terms of our process. So I think it's a great question in terms of how we get that input.
Thank you. Okay. Are there any? Yeah. Renee.
I would like to make it more official that we invite the mayor to our next meeting. So therefore, I would like to move that we invite the mayor to our next meeting and reinforce that we need his leadership.
I second.
Any further discussion? All in favor?
Aye.
Opposed? The mayor has a new date on his calendar. We hope it works for him. Yes, we do. We don't control the mayor's calendar, but we'll be checking in. Okay. Are there any last questions about the process in the next week? You'll get an email, send it on. Everybody's good with that? You'll have help if you need it? Okay. Bob had a comment that he wanted to make about relative to the follow-on, the rollout, and that. I wanted to just...
Yeah, it's a comment and a question. It relates to what Craig mentioned when we started today about accountability and Ed's comments on leadership. Anyone in this room that had an opportunity to go to United Way's breakfast yesterday in the spirit of Snohomish County got a chance to listen to a gentleman who facilitated a meeting very much like this. Smaller group, half the size, but considering some very challenging issues in a very large community. And when that group was done, the question was asked, okay, so what do we do next? And one gentleman said, well, what do we do? What action do we take? And I'd ask the question, maybe we think about it and come back next time, is there something that I guess it's now 23, not 24 individuals who are the leads, not those who are their alternates, what kind of action can we take as a sign to the community that we not only came together and spent a good deal of time, some much more than others with respect to the committees, in coming up with ideas? What kind of leadership are we willing to carry out of here? An example, is there places in the city where maybe all 23 of us ought to show up after in the November timeframe or December timeframe and do cleanup in a very well publicized and attended event, and inviting the rest of the community to come in and help? And in addition to that, on the other side of the coin, are there Thanksgiving dinners on Wednesday night before Thanksgiving or Saturday after Thanksgiving that we all ought to show up and consider helping and providing food to those who need it as a sign that we're looking at both sides of these issues? So I would just ask you to think about that. What can we carry out of here that would make a statement to the community, make a statement to the business owners, make a statement to the service providers and individuals who are homeless in our community? Thanks.
Thank you, Bob. I think it's a really intriguing suggestion. So I think that covers it for now. We don't have additional questions on our list. We were going to be scrambling like mad rabbits to get the ballot put together for y'all. So wish us luck, and thank you for watching for that in your email and getting it in. The deadline will sort of be hard and fast, 1 p.m. on Sunday, October 12th, and you'll get it hopefully Tuesday, October 7th. So it's less than a week to turn it around. Don't leave town. Don't ignore your email. Thank you for getting back to us with the ballot and your thoughts. We really appreciate it. Thanks, everybody. Have a great 2 weeks, and we'll see you on whatever, the 16th.